Hello, everybody. I am an oncologist who treats cancer patients mainly with chemotherapy. Once I have written a short essay in my private blog titled like this: A Loser in the 6-Minute Clinic. Yes, that loser is me. Spending 6 minutes to one patient is an able thing in Korea. It means I have to care 40 patients per 4 hours. Yes, it's the full allocation of the time, including coming in and out of the clinic room. Can you imagine? They are not fast food customers, they are cancer patients. I hardly can treat patients very quickly as other Korean capable doctors. It is a very stressful situation for me. I usually burn out after a session of a clinic, and my assistant nurse had some difficulties for overtime work because my relatively slow work pace. I felt so sorry about that. That could not be a thing like I can say, I am the true doctor. I am dedicating for my poor cancer patients. And let's do it together. So nowadays, I am trying to treat patients very quickly, like 3 minutes or sometimes 1 minute, if the patient is quite well-being. It is for keeping the lunch or off time of assistant nurses and also for efficiency between a doctor and patients. But I have felt so sorry about such short clinic time, of course. Maybe there would be some patients who had been hurt inside of their mind. I think especially people who care about the other people more than themselves. Others like other patients and the busy doctor might act so thoughtfully that they couldn't ask or say something they wanted to. Of course, I afford time-consuming explanations if those are definitely necessary. The cancer patients usually don't come just one time, so the visit times get more and more, and understanding the language of each other builds up as time goes by. You know, even people who have the same mother tongue, we need to take time and put some effort to understand each own languages of others. It might mean that there needs some reliability too. Then doctors can treat the patients more efficiently and quickly. Of course, it does not always succeed. This is why I started to make video clips like this on YouTube. Actually, the prior and the bigger reason is the another Korean YouTube creator named Soram. Because I have been helped from her channel so much, I would like to be a person who can help someone like her. She always says that she is not a specialist, and if you are in a serious narcissistic relationship, please find a specialist who can help you professionally. But I am a doctor. Although the special subject is different, I felt like she has very deep and bright insight of that subject. And the most important thing was that Her video clips had helped me so a lot. So I decided to make video clips to help cancer patients because I am a specialist to treat cancer. And I always lack of time to explain in the clinic. Every country has different healthcare system, various cultures and available resources. But sometimes it's similar even in one country like this. Someone can afford any cost of anti-cancer drug or even can go to the other country to get the treatment, which is not permit yet their own country. While other patients have no family member who can care of them or just share of the things about their disease. Even the government can support the basic treatment costs. So I just try to say something about cancer treatment and patients in this channel. I feel like this would be a story about cancer patients' worries or questions rather than a guide of cancer treatment. And I sometimes would like to say about myself a little bit as an oncologist in Korea or just a human who have many life problems. Almost of the questions and stories might be Korean ones, but I think some people, yes, there were really some patients like Korean American or Korean German and so on. One of my patients was an American soldier who was a mother of children. I started her chemotherapy and she had to come back to her mother country. She asked that which part of her country would be better to treat her cancer. And I remember her Halloween mask, which had made all of us laugh during her chemotherapy. How can I forget it? Although I couldn't catch up her, I believe she had well got through it. Oh, this story reminds me of many other foreign patients who could communicate beyond the language. I think I couldn't be kind or helpful enough to them. Let's move on to the main subject again about eating sushi. Many Koreans or Japanese and nowadays many of other country people also enjoy sushi. We had usually said do not eat sushi during the chemotherapy. So many people ask me, can I eat sushi? No? Yes. They want to eat and ask. But sometimes there are patients who never eat sushi, although every time they ask and I answer, you can eat sushi because the drug you use is usually not decrease your white blood cell, which means the immunity. But please be always careful about hygiene with any food. But they ask every time and don't eat sushi because of their own worries. This shows briefly and definitely that people's psychiatric aspects, simply saying mind, could affect how much a lot in cancer treatment process. Chemotherapy had motivated by the World War I. The first chemotherapy, mustard gas, had been developed as chemical murder weapon. They named it because it smells like mustard, but it can kill people. After the war, scientists and doctors revealed that this gas can kill cancer cells as well. That's the very poison is medicine. We call this class chemotherapy as cytotoxic anti-cancer agent. The cytotoxic agents directly attack the cells. According to the subclasses, the mechanism is a little bit different. But nowadays, there are new classes of drugs showing up through many pharmaceutical companies. Targeted therapy is not a brand new one, but recently shedding new light by conjugating immunes like united or combined with other cytotoxic agents. And immunotherapy is a whole new class of anti-cancer agent. It does not directly attack the cancer cells. It promotes the immune cells in the patient's bodies. I know, it sounds fantastic, yes? But its batting average is not that high. I mean the response rate. Primarily, human immunity is for fighting against the bacteria or cancer cells. We can assume cancer patients' immunity is not that strong against the cancer cells. So, lately, many companies and doctors are doing clinical trials to improve the batting average by combination with cytotoxic or targeted therapies. Let's go back to the main question again. Is it okay to eat sushi during the chemotherapy? Like I told you, it is helpful to know your drug class. And recently, many doctors give immune boosters like long-acting GCSF after the chemotherapy in many developed countries. So, even you are treated with cytotoxic agent, it is a very rare thing that your immunity severely decreases. Like a leukemia patient who has to go to an aseptic room and be isolated. I mean that you don't need to be extremely careful about your food. But please remember to make and eat clean food is more important than the kind of the food. I hope peace in your soul and body. 여러분의 영혼과 육신의 안녕을 바랍니다.